Things COVID.
Welcome to All Things COVID. This is a podcast that will shine the spotlight on COVID, thyroid disorders, obesity, and vitamin D deficiency. And to help us understand the correlation between COVID and each of these conditions, we have with us Dr. Usha Ayagari, who is Senior Endocrinologist, Apollo Hospitals in Chennai. She is also very passionate about type 1 diabetes. She's part of several webinars and webcasts disseminating information on general health and well-being. And first up, thank you so much, Dr. Usha, for joining us on All Things COVID. How are you doing?
I'm doing great, Sheetal. I hope you're safe and that you're looking after yourself. Thank you so much for having me. It's an absolute pleasure and honor.
Thank you for being here, taking some time of what I can imagine is a very, very crazy manic schedule for you. But, speaking of general health, I wanted that to be my first question. How has the current pandemic, Dr. Usha, impacted health and lifestyle? If you were to give us an overview.
So I would love to, Sheetal, because the other podcast that we did about type 1 diabetes was very information oriented, but I really want to have a bit more fun in this because whenever we discuss lifestyle, there is a tendency to get a little preachy and a little didactic and to maybe tell our patients off in inverted quotations for not doing what we expect them to do, when I have to say most of us, myself included, are perhaps not the best candidates when it comes to practicing what we preach.
Right.
So, and especially during this pandemic, I have to say it has impacted my lifestyle as well. We know that with the lockdown, resources have been extremely limited, even for the most dedicated people. We know that people who've been members of health clubs or gyms or swimming clubs or whatever have not had access to these regular facilities. But that doesn't mean that we need to compromise too much on our health and lifestyle goals. I tell my patients, if you live in an independent house, go out and walk around the house, call out your neighbors and make them run around theirs. You know, it's good exercise and fresh air for all involved. You don't need to put yourself at risk by going outside. But on the other hand, if you are stepping outside your front door, please wear your mask, even if it is only within your compound or within your apartment block.
Right.
For people who live in apartment blocks, you know what? You have the best deal of it all. You have stairs. Going up and down a few flights of stairs 2-3 times a day, walking up and down a long corridor. This is more than enough to start off and keep your daily exercise regime going. But the most important thing, and this I have to say has given me a great deal of concern, is the upset in timings that I've seen, Sheetal, with the lockdown, with the work from home. And I have to say, I've personally been guilty of this. We relax a little bit. We know that we don't have to maybe run to beat the traffic and get in the, commute by 8:30 to get to work at XYZ time. So maybe we all wake up a little later. We all eat a little later. Breakfast gets a little later. Lunch gets a little later. Dinner is an even more relaxed affair. God knows at what time. We're all a bit more sedentary, and all of these things, think of this as a huge burden that you're placing on your system, a huge stress that you're adding to your physiological system. So how your body works and the hit it takes for each of these things that we do may not show up today, may not reflect tomorrow. But this is something that we are going to have to face the consequences of at some point in the future. And the other thing that really worries me is how young this is starting.
Yeah.
Children who've been off school or homeschooled in front of computers, sat in front of screens the whole day, unable to go out and play, unable to have any meaningful physical activity. This is going to hit our next generation in a really huge way.
And that's just why I think we've decided to ask you this question, because we need to set this in perspective for the rest of our listeners so that they can carry the message forward. It's very important that we think about the impact that COVID has had and what the ramifications of this impact or the future is going to look like, especially for young ones. And you made that point.
Absolutely.
Let's move into things that I've got in my little, goodie bag. I can't say they're goodies at all because we're talking about obesity, thyroid disorders, vitamin D deficiency. So clearly not things that are pleasant at all. But let's understand, Dr. Usha, what is the interaction between obesity, ethnicity, and COVID-19?
Now this is a $1 million question. So let's start with ethnicity. And this has several ramifications because all of us South Asians have a higher risk of lots of medical issues, diabetes, high blood pressure, heart disease, obesity.
Right.
Now, each of these things are nasty and harmful in their own way. But what we need to understand that each of these things also puts us at a higher risk of more serious complications and worse outcomes with COVID.
Mm-hmm.
So it's not bad enough that we are likely to get these in the short term or long term. If we are at risk of these, we face worse consequences should we be unlucky enough to catch COVID.
Right.
Now, of all of these, even for people who perceive themselves as inverted commas healthy, obesity and inactivity are huge, and I can't emphasize enough, huge risk factors independently for COVID.
Right.
For people who have, for example, an Asian BMI over 25. Now, BMI is just a measure of your height and it's a ratio that we calculate taking your body weight and your height into consideration. And for people who have a BMI over 25, and for those who are curious, just Google BMI calculator, plug in your height and your weight, and it'll tell you your BMI. A BMI over 25 puts you at an increased risk of disease severity from COVID for an Asian population. 25.
Right.
And that's not much at all.
Right.
Now, when we look at the other implications of corona and obesity, we know that people who have obesity have, for example, they are more likely to be more severely ill. They are the people who are more likely to require ventilation or oxygen. And they're the people that are more likely to have more complications and recover worse. Now, also remember that with COVID, for example, we've heard about this pro-nursing. So people are turned onto their tummy to be nursed. And all these things are more difficult for people who are obese. So you are metabolically unhealthy. Sorry, I'd like to read that sentence. So with obesity, our metabolism is at risk.
Okay.
And we've known right from the beginning of this pandemic that people who have obesity have a much higher risk of worse outcomes with the COVID. And we have something called non-linear relationship. Non-linear just means people might feel that, oh, I'm only a little overweight, I might do better, or that somebody is much more overweight or obese, they can do worse. Unfortunately, it doesn't work that way. At any degree of overweight or obesity, we are finding that people do much worse than somebody who's of a normal weight. So obesity is something, combine that with our ethnicity and with our risk of other chronic conditions, we do worse.
Okay. All right. Now, here's this question. I'm not entirely sure we addressed it directly, so I just want to, underline it over here. Are overweight and obese individuals at a higher risk of catching COVID? Is there a connection there?
Now, again, we are, when we think in terms of the amount of information we have at COVID, we're still very early on in the amount of information we have about anything COVID related. As far as we know at present, the data doesn't seem to suggest that they're at more risk of catching COVID. But what it does suggest is that their outcomes are certainly influenced by their weight.
Right, absolutely.
And as I said, that relationship is not linear. It is not that the heavier you are or the lighter you are, I can't put a number on it above 25. I can't put a number and say someone with 27 will do better than someone with 35.
Correct. Understood.
Right. So that is the risk.
That is a risk. All right. Let's move on to another condition. This is thyroid. Now, are thyroid conditions, Dr. Usha, influenced by COVID? And again, there's another question in there as well. Is the care for thyroid patients any different?
Let me take the second question first. It's not, it is being affected. The care for thyroid conditions is being affected by COVID. And rather than different, I would use the word difficult because logistically things are becoming more difficult. So are thyroid conditions influenced by COVID? As far as we know, COVID is not giving rise to any increase in the amount of thyroid conditions we're picking up, except for inflammation, a condition called thyroiditis. So as we know, COVID is a condition of general inflammation. There are all the tissues. So the lung tissue, the complications we get is because of inflammation, and it can cause inflammation in the thyroid as well, and that can precipitate a condition called thyroiditis. Now, again, the course and the recovery from this, early days yet. We really don't have enough in the literature for me to be able to tell you patient X will do this way and individual Y will do that way. But what has become more difficult is just delivering care around this. So, for example, somebody notices a lump in their thyroid or a little nodule. Previously, we could have them, ultrasound and investigations done in 2 days and a diagnosis in 5 to 7 days and whatever is necessary done. But now it's becoming a lot tougher for us to provide that kind of care to patients. So what I would say is, don't neglect it, because for most conditions, we are still able to offer care through teleconsultations, through video consultations, and 9 out of 10 times, we may not need to do anything more than do a video consultation, look at the blood test, and then sort things out. And the 1 out of 10 times when perhaps we do need to see you or send you for any kind of a procedure, send an individual for a procedure or an intervention, we are able to arrange that. So yes, thyroiditis is an issue. Yes, care delivery, as with all other conditions, is slightly more complicated in terms of the logistics. But you know what? We are a resilient country. We are a jugaad nation.
Resourceful.
So we are a resourceful nation. So we can still manage these things.
Absolutely. Yes. The word resourceful, Dr. Usha, I must say, came to my mind when you were talking about apartment dwellers and how they have it simpler.
Absolutely.
They have long corridors and staircases. We found all manners of ways to stay healthy, despite the limitations on our mobility in recent times. So there is
absolutely
this as well. Let's move on to the next one in my bag: vitamin D deficiency. What is the relationship, Dr. Usha, between COVID and vitamin D deficiency?
Now, let me take one step back. Vitamin D has become the go-to for us for almost anything. Right. And for a country that lives in the sunshine, we are a huge majority of our urban dwelling, office working, indoor living population is vitamin D deficient.
Can I tell you, Dr. Usha, at this point that I have within arm's reach my D rice. I'm just eating for it.
Let me tell you, mine is only 6 feet away.
Oh, see?
I'm socially distanced from my vitamin D.
But yes, to come back, you were saying, it's for a country that has so much of sunlight.
We are singularly averse to going out into the sunlight for any length of time. Now, more and more, when you look at the literature, vitamin D seems to be mentioned in relationship to everything, from diabetes to cancer to COVID, as you would expect. But what we don't know, there is a slight difference in medicine between association and causality. Association is several things turn up together. Right. So diabetes and high blood pressure might be frequently diagnosed in the same individual, but nobody would say that diabetes causes high blood pressure. Right. Similarly, you see vitamin D deficiency, and whether that is just because it is so prevalent, but you see it in association with a lot of things. And there seems to be some suggestion, certainly where diabetes is concerned, that maybe vitamin D deficiency may have a role in terms of how frequently we pick up diabetes, for example. But in terms of COVID, it has been shown very frequently that it is associated with. But what hasn't been shown is that it is actually in any way causally related. So there is a small but significant difference. So that causality has never been established. So we need to be very careful about that.
Now here's the question that's meant for the prescription list that usually comes with that we ourselves sometimes lay people advise upon themselves, right? Shop for vitamin C, shop for vitamin D, give me 1 zinc, give me 10 strips of magnesium, everything, a compendium really of all all what we have at our disposal. I got to ask you about vitamin D. Does vitamin D supplementation help prevent or cure COVID-19? That's really
Again, I think if you wanted to light a match to a debate, vitamin D and COVID would be a very good topic to light that match under. Okay. And as with vitamin D, we've had so many debates about vitamin D and other conditions, and this pandemic has just escalated that debate multifold. It's true, and we are understanding that groups that have traditionally been vitamin D deficient or insufficient are also disproportionately impacted by COVID. But what we need to be aware of is that people who are vitamin D deficient, who am I talking about? I'm talking about the elderly, the frail, people living indoors, people with, for example, our Asians.
Right.
But these are also people who are traditionally vitamin D deficient, but also a high-risk ethnic group for COVID. Right. So is it just that both vitamin D deficiency and COVID are existing in the same population? But the one thing we know, and there has been one huge Australian study that looked at giving vitamin D. I mean, there have been several small studies, but this Australian database looked at 20,000 people. Right. And what it showed was that giving vitamin D did not reduce the risk of COVID, did not reduce the severity of the acute respiratory infection, and it didn't have an overall effect on the duration of symptoms, except that there was a half a day. So people who had vitamin D supplementation seemed to recover half a day earlier.
Okay.
Now, whether this half a day is something that you want to take in the larger scheme of things is, I guess I will take half a day, as you said. But there is absolutely no data to draw a line from A to B, from vitamin D to COVID, to say supplementation makes recovery or that it makes recovery faster, or that it makes the illness any less severe.
Right. Got it. Got that on vitamin D. So we've checked off 3 things on this podcast so far from a broad level. Vitamin D, we've spoken of obesity, we've spoken about actually 4 ethnicity and also thyroid conditions. The time to actually wipe the board clean and have some pointers from you on general things that we can do to reduce our risk of contracting COVID-19, Dr. Usha. What will you put up on the board for us, on the metaphorical board?
To be honest, the same thing that we've all been talking about for the last year, mask, distance, hand wash. I cannot emphasize enough how these basic methods, people will run for their vitamin D. Without their mask, I'm afraid.
Right. Yeah, right.
So the simple measures are still the most effective. Please mask, please distance, maintain that 6 feet distance, and please wash your hands. The second most important thing, and we have questions every single day about it, vaccinate. Yes, please vaccinate. Which vaccine? Any vaccine that you have access to, except for certain specific conditions. And your doctor will advise you on if there is any reason why one or the other vaccine would be unsuitable for you.
Right.
If you have access to vaccination, take the vaccine, any vaccine that is accessible and available. Right. The third thing you can do for yourself is to spread this message. Because please remember, you can help yourself, but if 10 people around you are safe, that makes you safer.
Right.
So look after yourself, but look after the 10 people around you. Take care of pushing them into vaccination and being sensible in terms of their civic responsibility, and you will be all the safer for it.
Right. And I'm going to leave that on our metaphorical board for everybody to absorb those pointers from you, Dr. Usha. And one more time, thank you so much for joining us on All Things COVID. We look forward to catching up with you soon again, perhaps on another topic altogether. Thank you so much for all the great work you've done in building awareness and for all the great work generally as a healthcare professional.
Thank you so much, Sheetal. It's been an absolute honor and an absolute pleasure. And I would just like to sign off with one final message. Please take care of your lifestyles. COVID has made it challenging, but not impossible. Our health is the only thing that we can really hang on to in these uncertain times. And you are the only person that can take absolute command of it and take care of yourself. Please stay safe. Please stay responsible. Please stay healthy. Thank you so much.
For more discussions and resources, visit tccmc.in.